Good day, everybody. This is Chris of the Ancient Scholar. Hope this video finds you doing well. And we're going to go ahead and continue our discussion about the changes that are coming down the line regarding the National Registry Emergency Medical Technicians certification process for advanced level providers. So essentially what's happening is the psychomotor examination that I mentioned in the last video in its current form is going away. So once you are near or have completed the paramedic curriculum at whatever institution you're going to, and assuming that curriculum meets certain standards and follows certain educational content guidelines set forth, not by National Registry. National Registry is really just a testing organization, but from the Department of Transportation, then you are able to take the advanced level certification process from National Registry and obtain certification through NREMT, if that is a part of your educational process. So essentially what's happening is that psychomotor component, as we've known it for decades, is going away. So there will be no formal psychomotor test site. That will no longer be required as of July 1st, 2024. So on June 30th, 2024, the psychomotor examination will come to an end, and that will no longer be a component of the National Registry testing process for certification. Now, the individual educational institutions and the guidelines which they fall under, be it a state or local mandates, very well may have their own integrated skills testing process. So that may not go away. For example, the institution I teach at, we will have a formal skills testing process at the end of our capstone process when our students complete their capstone/internship requirements. They will still be required to complete a final skills testing process through our program, but it will not be overseen by a National Registry representative. It is a part of the curriculum of our program, and that is probably going to be very different from program to program. So this does not change any of the specific local, state, or educational institutional requirements that you may run into. This is a National Registry certification testing requirement that's changing. So what happens is once that student has completed the prescribed educational curriculum at whatever institution, and assuming that that institution follows Department of Transportation guidelines, they will only take one examination. This will be a computer adaptive examination. All right, so that's the big thing that's happening, is that there is only one exam. It is a computer-based examination, and essentially it's the same process for signing up for it through National Registry. It's just that the way that this new examination is structured is going to be very different. And essentially what National Registry is doing is they are attempting to develop a process or put into place a process that tests both psychomotor and cognitive educational content or cognitive content in one examination process. All right. And so that's kind of what's happening, is they're getting rid of this skills testing, and they have developed new test questions that attempt to essentially test out critical thinking and psychomotor-like integration capabilities of the candidate without putting them through a formal psychomotor examination process. So that's essentially what's happening. All right. And so how do they plan to do this? Well, first of all, this is all based upon some testing that National Registry looked at from 2019. So this really goes back to 2019. And back in 2019, there was something referred to as the National EMS Practice Analysis that occurred. And then in 2021, there was an addendum to that known as the National EMS Practice Analysis Addendum. And these two documents really provided the information that National Registry needed to figure out what kinds of content areas do we need to test on, and what kinds of test questions do we need to develop that will adequately assess those content areas. And so the aim of the paramedic certification examination really comes down to 5 major concepts, and those concepts include the following. Testing the ability for the candidate to provide safe, effective care with medical oversight through the integration of cognitive, psychomotor, and affective processes in various patient care presentations. So they need to be able to develop test questions that determine cognitive, psychomotor skills, and affective behaviors, and integrate those 3 major concepts into the testing process. Number 2, assess each scene, determine the safety of all individuals present at the scene. 3, assess patients to identify threats to life and limb and implement care to reduce morbidity and mortality. 4, use fundamental knowledge of anatomy, physiology, and kinematics to identify concomitant injuries and reduce loss of life and limb. And then finally 5, apply fundamental knowledge of anatomy, physiology, pharmacology, emergency cardiovascular care, and the etiology of disease processes to determine appropriate patient interventions and transportation destination that will promote positive patient outcomes. All right, so that is the purpose of this new examination process, right? And again, this is based largely on the 2019 National EMS Practice Analysis and its addendum that was published in 2021. And essentially what they developed were 5 domains. So these are areas of educational content that they needed to test. And those domains include the following: airway, respiration, and ventilation is domain 1. Cardiology and resuscitation is domain 2. Trauma is domain 3. Medical, obstetrics, and gynecology is domain 4. And then EMS operations is domain 5. All right, so those are the broad areas of psychomotor, affective, and cognitive content that they needed to draw from to develop test items. All right, and because there's no longer this formal psychomotor skills testing that they are doing or requiring, they also needed a proxy or some alternative way to determine how capable the candidate is at thinking about psychomotor actions, taking skills, giving medications, those psychomotor things, cognitive knowledge of stuff, and then affective or behaviors. Can we do this throughout different phases of a call, of a typical EMS call or a 911 call, which is kind of the bread and butter, the typical operating situation that you're going to run into as a provider, right? And so they developed this concept of what's known as clinical judgment. And this is a very important component of the testing process now. All right, and this actually comes directly out of the 2021 practice analysis addendum. And essentially what they need to do with this new examination is test this concept of clinical judgment. And rather than really giving you a really strict definition of clinical judgment, because that's actually really hard to define, Instead, I'm going to talk about what the components of clinical judgment are and what they're looking at, and hopefully that'll make a little more sense as I, in subsequent videos, start talking about the types of test items that we're going to be running into. So essentially what the candidate now needs to do is they will be given items that will allow them to recognize cues and then analyze those cues, define hypotheses. All right, so I see something, I analyze it, I define or develop a hypothesis for what I think is going on, generate solutions, what's my plan, take action, and then evaluate the consequences of that action. And of course, that might also involve making changes to the plan. And not only do we need to do those or do those components, but we need to be able to do that within different areas or domains of an EMS call. And there are 3 major components of an EMS call that are going to be tested. The first component is en route, and that's going to include dispatch information and anything that happens while you are en route to that call. So prior to and up to patient contact. And within that situation, think about getting dispatched, getting the ambulance, going to the scene, what kinds of communication, what kinds of operational things are going to go into there. All of that, you're going to be tested on that. And what's going to happen? You're going to need to be able to recognize cues, analyze cues, define hypotheses, generate solutions, take action, and then evaluate the consequences of your action. All right, so what happens en route? And then you're going to be tested on what happens on the scene. You make patient contact at the scene, right? What cues are you analyzing, right? What cues do you need to pick up on? What things do you analyze? What hypotheses you generate? What solutions? What actions do you take? And then evaluating the consequences of those actions. And then finally, the third component, or the third clinical judgment domain, is post-scene. So this is stuff that's going to happen after you have made patient contact, you've moved the patient to the ambulance, you have left the scene, and you are now doing transport and ongoing assessment from that point to transfer of care at a facility. Again, recognizing cues, analyzing cues, defining hypotheses, generating solutions, taking action, and then evaluating the consequences of your action. All right, so this is a major component of the changes that are coming down, is this concept of clinical judgment. And so what the National Registry has done over the last few years is they have developed new test items that aim to assess the candidate's understanding and ability to employ clinical judgment en route, on scene, and post scene. So what does that mean for us? Big picture, it means that the kinds of test questions that we are going to encounter are going to be far more complex than what you may be used to. The standard multiple choice question where you're given some information and then it asks you to select an answer, and typically there'll be 4 A, B, C, D, and then one of those is either correct or most correct, and you have to answer that. That's kind of the standard multiple choice question that has been employed for decades by the National Registry. However, now that clinical judgment, well, I talked about earlier, is a major component of this new examination process, there are new items that have been developed that are assessing the candidate's ability to recognize cues, analyze cues, develop and define hypotheses, develop a plan, implement actions, and then assess the consequences of those actions. And so these new test items are going to be inherently more complex to assess a candidate's ability to grapple with clinical judgment. And these new test items are referred to as technology enhanced items, or TEIs. And in subsequent videos, I will go into some detail and talk about these TEIs. So hopefully this video helps you kind of understand from a big picture standpoint what is going on and why the examination process is changing so much. Okay, thank you all so much, and we'll see you in the next video.